Hemophilia, a rare genetic disorder that impairs the blood's ability to clot, affects an estimated 1 in 10,000 individuals worldwide. In Kenya, the condition remains undiagnosed and poorly understood, leaving many patients grappling with limited access to life-saving treatments. For those living with hemophilia in the country, bleeding episodes can be debilitating, even life-threatening, if not managed with the right medical care. Despite the challenges, more families are finding ways to navigate the complexities of this condition by creating awareness and pushing for better healthcare provisions. One such individual is Karanja Maina, a 48-year-old businessman and devoted husband and father of 3 who resides in the bustling Gikomba area of Nairobi County. Maina has lived with hemophilia, a condition he was diagnosed with at a tender age.
I was like 5 years of age. Yes, I did cut my finger and the bleed could not stop. So I was taken to hospital, that's Moranga District Hospital, and was given the first aid. I went back home, the bleed could not stop. But having a history of hemophilia, my elder brother is hemophilia, they made a conclusion that maybe it's the same problem I'm having.
Karanja received an official diagnosis of hemophilia later in life, as it had previously been merely an assumption.
We lived just as normal kids with not that much knowledge of hemophilia.
In terms of treatment, Karanja recalls that there was no specialized care for hemophilia during his early years. The medical attention he received was the same as that for any other patient, without the tailored treatment necessary for managing his condition.
Today there is a great difference because the way we are treated is different from whatever was happened there before. Because like now we have an emergency clinic at Kenyatta, we have several clinics around the country.
Karanja reflects on his time in school, where his hemophilia posed significant challenges.
It was difficult because I could miss class. I remember even my class 4 final exam, I didn't do it. So I had to repeat because at that time, being a small boy, the school said that I'm a small boy, I can go back to and repeat the class. So most of the time I was out of hospital, out of school, and every time I had an injury, due to now there was no proper know how hemophilia, even at that district level hospital, I had to be admitted for a few days. I'm a businessman. I do all my things. Yet I do live, but I perform all my duties. Every time there's a way I know I have a bleed. If I know I have a bleed, because normally we get bleeds on the joint, if the medicine, I do go and take my medicine. Even I'm able to infuse myself. I know how to infuse myself. The challenge is now the availability of the medicine. The fact that it is a very expensive drug.
Karanja acknowledges that despite the high cost and difficulty of access to hemophilia medications in Kenya, they can get treatment through donations. To manage the day-to-day challenges of his condition, particularly bleeding and swollen joints, Karanja relies on home remedies such as using ice or cold water in a bottle, which he places on the affected areas to reduce swelling and ease the pain. He has become familiar with the signs of impending bleeding, fatigue, joint stiffness, warmth in the affected areas, and pain. Over time, the condition has taken a toll on his knee joint, which has severely impacted his mobility.
For me to use the clutch, it is because of the bleed that have affected my joints. That's how it's led to arthritis.
Karanja expresses deep gratitude for the support he received from the community he grew up in.
My wife, who normally takes care of me, before we got married, my parents were there, and the community had understood my condition because I was able now to communicate to the community, even to the school, about my condition.
Ruth, Karanja's wife and primary caregiver, was aware of his hemophilia before they got married in 2010. She knew about the challenges it brought.
I think love conquers all, because it is love that conquers all. Because that didn't weight me down than the love I had for him and the way he was so genuine to me. The time that we got married, that night we got injured due to more activities. So I have been living with it all along, loving him more, being friendly. Because you know, when he is injured, he is in a lot of pain. And the only thing you can do is just being concerned about him and being friendly so that you don't cause more trouble.
32-year-old lawyer Anthony Odeck started his journey with hemophilia just days after birth.
The time when my mother had just given birth and they had cut the umbilical cord. So the umbilical cord could not stop bleeding. So that is, the doctor noticed like it was constantly oozing fresh blood for the whole period when my mom was in hospital.
Doctors decided to keep his mother in the hospital for extended observation. It was during this time that medical tests revealed his blood's clotting factor was dangerously low, leading to a diagnosis of hemophilia type A. Despite extensive family medical history checks, Anthony says he has been unable to trace any other cases of hemophilia within his family.
Though there is a suspicion that maybe my great-grandfather had, because it was said during the times before he died, he had some disabilities. But it's not proven because those days medical records are not that good.
Anthony reflects that living with hemophilia, one will inevitably recognize that they are not normal, particularly during childhood.
Basically, in summary, a childhood with constant injuries and constant hospital admissions. I was constantly in hospital, constantly in wards, constantly getting intravenous factor. Actually, that time there was no factor because we had to import factor. And luckily for me, my parents had good medical insurance cover from the employer.
Life in school was also challenging for Anthony, as he often had to miss classes due to his condition. As a child, he had dreams of becoming a professional football player, but his condition made that aspiration difficult to pursue.
They will constantly make fun of you as a weakling, a kilema, or a disabled person. Because one day you're okay, the next day you're on crutches. One day you're okay, the next day you're limping. One day you're okay, you're not coming to school in a month. So it would affect also my grades. There was the lack of acceptance, the lack of knowledge of what you're going through, of what, because your colleagues can easily make fun of you, or people can easily judge you. And if you do not know yourself, if you've not accepted yourself, it is even harder. And that's when now you dive into depression. And at the time I was very depressed. So it creates a lot of mental and psychological issues for children. So it was around the time when I was finishing campus is when I had to actually, put my foot down and say, okay, you know what, you need to accept yourself and do what needs to be. So because the lack of acceptance now brings about ignorance and arrogance. So you find most of our teenagers, even me myself, I was very arrogant and rude. I was not taking care of myself. I started abusing drugs and alcohol because you're trying to drown the pain, the mental pain and torture that comes from these social interactions. My siblings and my parents never understood me at all. So I ended up being secluded and staying in solitude and dealing with these pressures from as a child and as a teenager alone, which was very hard and to a point that I became even suicidal.
In 2017, he was invited to join the board of Kenya Hemophilia Association, KHA, but at the time he was reluctant. His condition had worsened and he was now dependent on assistance to get around, which made him hesitant to take on such a responsibility.
I took up the calling, I joined the board, and I ended up going for various activities and congresses abroad. And it really opened up my mind. And I was able to interact with people even in Europe who had also this condition. And they were living a normal life. and they were able to live with it and move on. So I was encouraged, and I was able to become a better person.
Most individuals with hemophilia are diagnosed at a young age, and throughout their lives, they often require dedicated caregivers. Irene Wakaba, a teacher and a mother of 3, a daughter and 2 sons, is one such caregiver. Her 9-year-old son, Ethan, has hemophilia, and Irene has taken on a crucial role of supporting him through the daily challenges. Additionally, Irene is a carrier of hemophilia herself.
He has hemophilia A, deficiency in clotting. Yeah, he has a deficiency of factor 8. He was diagnosed at 8 months old at Kenya National Hospital. I knew about hemophilia from my late son. I had another son, my second born, who was 3.5 old. At 3.5, he hit himself at his forehead, and he developed a big swell. And when I took him to hospital, I think after a week, I brought him to Kenyatta, and that is when I was told he has hemophilia. That is hemophilia A. But unfortunately, after a week, he passed on.
Irene admits that when she first learned about hemophilia, she was filled with fear.
It was scary because I had never heard of such a disease. I didn't know that somebody's blood would not clot naturally. I knew that after you get a cut, your blood is just supposed to clot naturally. And you know, when you know about something, you try to seek information even from friends and the society. The society would tell me it is a disease of the western side of Kenya. It is a curse. So it was really traumatizing because I didn't understand what was happening. And that is when I started doing some research on the disease. The minute you realize your son has hemophilia, life has to change because you cannot leave that child alone. I think the biggest duty you have is to ensure that this child does not fall and get an injury, does not touch a sharp object and cut themselves, or even bang himself anywhere.
Irene says that while there is no specific diet required for managing hemophilia, she focuses on ensuring Ethan has a balanced and nutritious diet to support his overall health.
Normally what you do, maybe you increase the meals that contain iron because of the blood, because they may even have an internal bleed, but you cannot know. The only bleed you can know is a major bleed, but there are behaviors that can help you identify that this child has a bleed. For example, they may have a lot of headache, or sometimes you'll see them getting bored, they don't want to do anything, and also the bleed comes with a lot of pain. So for a young child, there will be a lot of crying.
Irene explains what she does when her son Ethan gets a bleed.
If you assess the bleed and it's a minor bleed, we give something called tranexamic acid. It's just a tablet that at least makes the blood heavier, for it at least not to flow a lot. And eventually it can clot. Something else you can do, you can use an ice pack, but you have to wrap this ice pack with a towel, because if you put it directly, it can burn that child.
However, Irene emphasizes that it's important at times to take the child to hospital.
And again, when the child has a bleed, you're not supposed to take more than an hour to get to hospital. It has to be within 1 hour so that they can be able to attend to that bleed.
Irene says access to medication for her son Ethan is inconsistent.
Our medication is donated from donors. The government has not been able to get us medicine. So sometimes we have that medication. Sometimes we don't have. It depends on the donor. Sometimes the donor can even send medicine, but because of the demand, maybe we can take a few months when we don't have medicine.
Despite the help they receive from donors, Irene acknowledges that hemophilia not only takes a physical and emotional toll on families, but also a significant financial one.
You can visit that hospital even 3-4 times in a week, even every day in a week. And anytime you go to hospital, you know you have to pay a fee. And especially for somebody who has no job, and actually most of us cannot be able to keep our jobs because of this demand of caregiving for these children.
As a hemophilia carrier, Irene recounts the challenges she has faced navigating the condition.
When you have your menses, it goes for even 9 to 14 days, whereby I cannot even use, normally the menses use up to 2 packets of pads. I use more than 6 or 8 packets in a month. And especially in the first days, the day 2, day 3, when I was younger, it was easier. When I got my firstborn now, I think it got worse. And even childbirth was not easy, because I give birth, and after giving birth, I bled for more than 3 weeks. And then nobody knows you have hemophilia then, you know. So the only thing they inject you is vitamin K. So it also comes with anemia.
Irene also shares that her firstborn might also be a carrier, which adds another layer of concern for her.
I think I see like she fears a lot to be a parent, because she always tells me, Mom, I don't think I'll get married. Again, she also has, I think she's a carrier because her periods also take more than a week. And I always make sure I go with her to these hemophilia meetings, so that at least she can be able to hear the experience and learn more. But as a normal human being, it is not easy for her.
Dr. Shikuku, a hematologist and the Director of Medical Services as well as acting CEO at the National Spinal Injury Referral Hospital in Nairobi, has spent the past 15 years supporting patients with bleeding disorders, including hemophilia. He explains how hemophilia is genetically passed from mother to her children.
Our ability, first of all, to clot is a function of chromosome, the X chromosome. Okay? Women have 2 X's, men have only 1 X. So my ability to form a clot is because my mother gave me a normal X. Okay, so that normal X can trigger clotting factor protein production, and I'll be able to form a clot. If I'm born, conceived with an abnormal X, that simply means the moment I'm being born, at the point of my birth, you go through some bit of distress through the birth canal.
According to Dr. Kibet, most hemophilia diagnoses are typically made within the first 2 years of a child's life, often triggered by unusual or prolonged bleeding after minor injuries, vaccinations, or medical procedures like circumcision. However, he notes that late diagnosis remains a significant challenge in Kenya.
We've never really taken time to sufficiently capacity build our facilities to be able to diagnose this disease. A lot of hospitals have not developed capacity for testing.
The chronic shortage of essential medication, particularly clotting factor concentrates, which are vital for managing bleeding episodes and ensuring survival, is a major challenge. These medications are not only expensive, but also not readily available in most public health facilities, making access extremely difficult for many families. Adding to the burden is the fact that Social Health Authority SHA, formerly NHIF, does not currently cover hemophilia treatment under its benefits package.
If only the SHA thing can be able at least to cover our medicine, that is factor. Even if it is a few doses, it is going to help our patients very much, because we donate just like the other Kenyans. We are giving our contribution for the medical coverage, but our patients are not getting the factor.
So we only hope that the SHA regulations can be able to be inclusive, so that we can increase the umbrella that covers people living with NCDs and specifically bleeding disorders.
As a country, we should be buying drugs to support our patients. I don't see why we should be saying SHA is catering for patients, and yet it's not catering for bleeders. I can only praise the government for one reason. The donations that we are getting from a body called World Federation of Hemophilia is waived. So the taxes have been removed by the government.
When it comes to SHA, it should cover some of these diseases. You know, I don't know how we make our laws. And it's unfortunate that during the drafting of the SHA law, I was already outside National Assembly. Because there is where we will have taken that advantage and made sure that hemophilic is also covered
Although hemophilia is commonly perceived as a man's condition, Dr. Kibet clarifies that it also significantly affects women, primarily as carriers, but often with serious health complications.
In fact, I fight with the maternal mortality because we hardly take time to determine who these women are. And our women are suffering in silence. They are dying in silence. They actually bleed to the extent of dying.
Remain largely uninformed about hemophilia, a gap that contributes to delayed diagnosis and inadequate care for those affected. Limited public awareness means many people do not understand the genetic nature of the condition, its symptoms, or the importance of early treatment.
There are people out there who don't know they have hemophilia. They're suffering in silence. They're suffering with disability because, of the society, or maybe lack of rather poverty, and maybe the lack of access to good health care.
Even the medical practitioners, because I remember back to the days I would go to hospital and tell a doctor hemophilia, and he would look at me, what is that?
While general awareness of hemophilia remains low among the broader Kenyan population, Dr. Kibet points out that patients themselves tend to be highly informed about their condition.
Because doctors do not even know what to prescribe sometimes. And the patient would say, I'm on factor 8, daktari, this amount, and you infuse it this way.
According to Kenya Hemophilia Association KHA, the estimated prevalence of hemophilia in Kenya is approximately 1 in every 10,000 Kenyans, which translates to around 5,300 to 5,500 individuals living with hemophilia. So far, there are only 1,188 patients diagnosed and receiving care. This leaves more than 4,000 individuals undiagnosed or untreated.
So hemophilia is global. There is no community that is exempt. Neither do we have hot zones and cold zones, the way we talk about diseases and, areas of high prevalence. No, it is equally distributed across all communities. Equal. What does that mean? If you go to any community, 1 in every 10,000 has a hemophilic. 1 in every 10, okay, 1,000. Or 1 in every 5,000 males is a hemophilic. So if you have 50,000 Kenyans, we should be having 50 million Kenyans, we should be having at least 5,000.
I said, let us support the Hemophilic Association of Kenya because they understand. They can literally go to every health center and educate and create awareness. They also know their clients. So then they be able to educate or create awareness to the healthcare professionals who are closer to those clients.
The fight to ensure that Kenyans living with hemophilia are officially recognized and their health needs adequately addressed began several years ago, led by KHA through those who have been championing for the rights of hemophilics like Dr. David Ole Sankok, now a member of the East African Legislative Assembly EALA. During his tenure as a nominated Member of Parliament representing persons with disabilities, Dr. Sankok used his platform in the National Assembly to champion the rights of Kenyans living with hemophilia. He tabled a petition in Parliament calling for greater recognition and support for hemophilics. The petition, submitted in 2019, garnered approval in Parliament, leading to a supplementary budget allocation of 500 million shillings intended for hemophilia patient support.
It was never passed in the budget, but the proposal was taken up to the Committee of Health, all the way to Treasury. They were there. But I don't know what happened with the Treasury.
During his tenure as chairman of the National Council for Persons with Disabilities, Dr. Sankok also played a pivotal role in securing the official recognition of hemophilics as persons with disabilities under Kenyan law.
I know a number of them who can now save the money they will have paid as taxes, the money they will have paid as duty for their vehicles, or from the tenders they have access to government contracts through access to government procurement opportunity, and use them to buy those concentrates.
Persons living with hemophilia do not need to exhibit visible signs of disability to be recognized and registered as persons with disabilities.
Go there, get a medical report that you are hemophilic, and automatically you are registered as a person with disability.
Despite years of advocacy and parliamentary petition, Kenyans living with hemophilia are still fighting for full recognition from the government, not just as persons with disabilities, but as individuals in urgent need of sustained medical and policy support. Hemophiliacs continue to call for dedicated government funding, accessible medication, and the expansion of treatment facilities across the country. Living with hemophilia is not just a medical condition, it is a fight for dignity, support, and survival. For Willow Health Stories, I'm Nuru Abdulaziz.